for us what you decide to do. It honestly, it really does, because we want you to have your best interests at heart when we're helping you make decisions. It's ultimately your decision on what you do. We are the go-to. There's 28 of our agencies in the state of Texas. We cover 11 counties. So anyone calling that shift number, if they're within our 11 counties, they're going to get us. We used to have 3 benefits counselors. We're down to 2. Right now it's open enrollment. So you can just imagine when we help like 800 people within that 45-day span, we only got 2 people doing it now. Okay, but since 06, when Medicare started the drug plans, I did that every single year. Up until 2021, I did drug plans. So I just want you to know that, so you know when you're calling us, we're not selling you anything. We do not get compensated. Our job is just to help you. The SHIFT program is nationwide. Some are in area agencies on aging, some are set by themselves. So you are going to get the information from the best source possible. We have absolutely nothing to gain when it comes to the decisions that you make. Okay. Some of the things we do is the benefits counseling. We help people sign up for Medicare. We answer questions. We do the open enrollment every year. We help with Medicare appeals. I mean, basically anything involving Medicare. And there are some programs that pay Medicare premiums, and there's help with the drug plans. We apply to Social Security for that. We apply to Medicaid to help get the Medicare premiums paid. So basically, y'all have brochures. The red one that says Area Agency on Aging will just kind of give you a little overview on what we do, and there's strictly one that says benefits counseling. That will tell you everything we can do in there. I just want you to know we are impartial, okay? So we have nothing to gain out of it. It's a little hard in a way to talk about just Medicare and Medicare Advantage because there's so many components to it all, but I'm going to try my best to stay on track to keep it simple, and I know we've got about 30 minutes. We are probably going to spend more time talking about Medicare because Medicare is very straightforward, and there's numbers I can give you. Advantage plans, because they're kind of different. You're going to notice I don't have as many slides on that, but I can definitely give you a lot of detailed, in my mind, detailed information. Okay, so we are going to go ahead and get started. Now, the numbers for 2026 are not out yet. So in your slide, which everybody has a copy of my presentation with my notes that provide more detailed info, the numbers you're going to see in here are for 2025. Okay, so who in here is on Medicare, just so I can get a feel for it? Okay, and the rest of you just want to get that knowledge so you can become professionals. Okay.
They have to be here because of their job.
No, we have not a parent.
You have a parent, great,
Okay, good.
great. If you call us and say, hey, I need to look at mom and dad's stuff, as long as they give permission, one time we can deal directly with you. So we will talk to family as well to help people do that. Okay, so basically, we're going to kind of probably some of it go a little faster through it since some of you are on Medicare or maybe mom and dad are. But to get Medicare, you have to be 65 and older. Oh, I forgot to advance my slide. If you have ALS, end-stage renal disease, or if you get approved for Social Security disability, once you get 25 checks, you can get on Medicare. So just because you get on disability doesn't mean you're going to get your Medicare right away. That's the only way to get Medicare. You can't get it at 62 because you retire, and these are the only ways that you can get it. Okay. All right. The other thing I was going to tell you is try not to make this more complicated than what it is. It is really simple to understand because it's very straightforward. So don't get nervous or stressed or freak out. This is going to be very simple, and I'm going to try and keep it simple for you. Okay. So with original Medicare, you have Part A. Part A is typically going to be your hospital inpatient care services. It's your coverage that you have. Part A covers your hospital, skilled nursing, home health, hospice, and blood. Okay. Most people, as long as you've paid in for 10 years, you don't have a premium. It's free. You will notice that if you have not paid in, some people may have premiums. Sorry, I gotta tell the marketer calling. Is anybody else getting on spam calls? They're driving me absolutely
You would think it's
batty.
open enrollment.
It's crazy. I'm getting so many. But it's on page 4, and I don't think it's up there, 'cause my speaker notes are not up there on this slide. But, if a person has worked 30 to 39 quarters, they have a monthly premium of $285. If they work less than 30, their monthly premium for Part A is $518. That's in 2025. Again, most people get it for free. So Part A is strictly, they call it your hospital coverage. Does that part make sense? Okay. All right, now remember, these are 2025. Okay, you go in the hospital. You automatically have a deductible right now of $1,676. No matter what, you get admitted. There's your deductible. If you're in the hospital more than 60 days, you're going to notice that your co-payment's going to be $419 a day. If you're in there longer, it goes up to $838 a day. These numbers will change come January. I just did not have the new numbers yet to give you. Does this part make sense to everybody? All right, guys, you got the internet.
This is still Part A.
This is Part A. We're going to go over what's covered under Part A. So Part A is going to be your hospital. So you know if you were to go in the hospital and you only had Medicare, you had no supplement, nothing else, you owe a deductible of $1,676 this year. That's in hospital.
What's $419 per day?
If you're in the hospital more than 60 days.
Okay.
So if something catastrophic happened and you were in there day 61, then you're going to be billed $419 a day.
Okay.
But you're guaranteed that bill is $1,676 if you have no other secondary insurance to back it up. Skilled nursing facility also is covered. Again, I do not know if some of these rules have changed, but if you have to go into a skilled nursing facility, it's going to be billed under your Medicare Part A. The co-pays on that, the first 20 days, you don't pay anything. But if you're in skilled nursing, day 21, you're going to be charged $309.50 for that. Okay. Again, that's just so far. If you don't have anything else, these are your charges. Okay, it also covers home health care. You're not going to have that cost for the home health care. It's going to cover it. And you'll see on this one, it's fully covered by Medicare. Honestly, like I said, I don't know if every 60 days they review it, because I don't keep up a lot with some of the time frames on this, since I'm not actually doing that part of the job anymore. A lot of times if you get home health care, they might say, oh, well, we need to get you some durable medical equipment. That's covered under Part B, and you'll notice it'll say you might have to pay 20%. I will tell you now, Medicare does not cover bathroom equipment. So a lot of times they might, oh, you need handrails. You know, if it's anything for your bathroom, it's not covered under Medicare, just so you know. Or if home health goes to order you some durable medical equipment, walker, whatever, and you don't have any other insurance, you're looking at a 20% copay. Right? All right, it also covers your hospice care. And of course, they have to keep recertifying it. On hospice, everyone thinks, oh, a death sentence, not necessarily. You could get better on it because you're getting special individualized care. But hospice, that's covered under your Part A. Okay, and then on the next slide, it'll just kind of tell you what's covered. Medical equipment, any medications related to your diagnosis, pain management, some aids in your house, social work services, counseling. There's a lot of stuff covered under the hospice benefit. As of what I know right now, the medicines to manage your pain and symptoms, they have a $5 copay. Those would not be billed under your drug plan. It would be billed for the hospice. But you're only looking at the $5 copay. But you're not going to pay anything for that hospice care. And I'll warn you now, I repeat myself a lot. I'm used to talking to older individuals, and so I do repeat myself, and I use my hands a lot. And then the first 3 pints of blood. In a nutshell, that's A. You got your hospital, which you got your deductible at $1,676. You got your hospice care, you got your home health, you got your skilled nursing, and you got your blood. Is that part kind of simple? I mean, that's all A is. Okay. Now, Part B. basically is everything else. That's what they call your medical coverage. All right. So in the medical part of it, sorry, let me get it to you here. Okay. You'll notice the first thing is your doctor's services. Going to the doctor, anything that's outpatient, some preventive services, but typically with Medicare, and I know I'm jumping ahead, this year the deductible was $257. So if you get anything filed to your Part B, not your preventive services or your wellness visit, you're responsible for the first $257 out of your pocket. After that, you pay 20%. If you have another insurance, it'll pick up the 20%. But that's how Part B works. You pay the first $257 and everything else is 20%. So that would be your doctor's services, outpatient medical and surgical services and supplies, again, 20%. Some home health care, but you would not pay anything for those covered services, so sometimes they might bill some of the home health care under B. But again, you're not going to pay, you pay nothing for the covered services. And I do encourage you, if you actually want to learn more, really look at the speaker notes at the bottom on your packet because it really goes into a lot more detail. Durable medical equipment, oxygen, wheelchairs, walkers, hospital beds, 20%. If you use a nebulizer, that's covered under B. The medicine you put in the nebulizer is covered under B because you're using it in that medical equipment. I will tell you those walkers with the wheels in the seat, from my experience when I was doing it, a lot of the medical supply stores will not file it to Medicare because Medicare is not reimbursing them enough. And so a lot of times they're not getting covered. And so if you need a walker or something like that, you might have to pay for that out of your pocket or go to Walmart or Amazon, something in that nature. And then labs, tests, some diabetic supplies, some are covered under B, some are covered under D, which is your drug plan. Dialysis services, mental health care, x-rays, CAT scans. Again, think of anything outside of the hospital setting involved in your medical care. You got your $257 deductible, and then you pay your 20%. Okay, Medicare also does preventive services. And a lot of these, and they also do an annual, welcome to Medicare and an annual exam. A lot of the preventive services you don't pay anything for. But this is what I'm going to warn you about. And it's happened to me. You go to the doctor, you're there for your annual visit, they do your weight and everything, and they're like, do you have anything else going on? Well, yeah, I've got such and such. Guess what? That now turned into an office visit and I'm getting billed. Don't talk to them about other issues at your wellness visit. Don't, because it can turn into an office visit. Okay, so be very careful. You'll notice like the flu shot, I can't say that other word, the pneumonia shot, let's put it that way. A lot of it's covered under the B for preventative. But again, keep your wellness visit to a well visit. Don't start talking about other issues. They always get you. I told my doctor one time, I said, I'm not telling you. She said, why? I said, because then you're going to pay me, charge me for a visit. And she's like, just tell me. So be careful. All right, what's not covered? Nursing homes are not covered. That's long-term care. Dental, dentures, cosmetic surgery, hearing aids, hearing exams, glasses. The only time they're going to cover glasses if you have cataract surgery. But they typically will file your exam to Medicare because most folks, when they get older, it can be medically related, so they can file it to your Part B. But then again, you're looking still at your 20%. But a lot of the stuff that folks need are not covered. Okay. All right. Right now, like I said, that deductible is $257. It will go up in January. 20% co-insurance for basically most of your services. The monthly premium is $185. That typically comes directly out of the person's Social Security check. Okay. There are some programs that do help pay that cost. There's QMB, SLMB, and QI1. And I have given you printouts on all those programs. They go by your income and your resources. Now, if somebody's working, please know they don't count on your income. But if you were to call us, we could probably screen you and say, hey, you may qualify, let's apply to the program. QMB pays the $185, and it acts as a backup insurance to Medicare, so it pays all the deductibles and the co-insurance. SLMB and QI1 only pay the Part B deductible. So technically, like, you're on Medicaid, but the only one that's going to offer you basically the backup insurance is QMB. And I know that's kind of getting off topic of just Medicare and the Medicare Advantage, but I feel that's very important to know. If you or someone you know may qualify, or you think, look at the information I gave you, or just call us, because we will help you apply. It's like a 26-page application, and it's going to deter you, but we fill it out for you. Okay. So let me see what my next slide is. Okay. So again, it's taken out of your Social Security check, and some people deny it when it first comes available because they're like, oh, I can't afford it. And here in a minute, we're going to talk why that could be really a bad idea. But if you do not have it taken out of your Social Security check, or let's say you're not on Social Security and you get on Medicare, you can set up, Medicare will either send you a bill every 3 months, or you can set up Easy Pay and they'll take it out of your bank account each month. Okay, so some people all of a sudden they get a bill and they're like, oh my gosh, this is like $500 and some dollars. But as soon as you get on the Social Security, it'll start coming out of your check. But a lot of programs, just so you know, they ask you what your gross income is. That's before anything's taken out. So if you ever do call somewhere, they might say, okay, well, do you have your Medicare premium taken out of that? And, you know, just so try and know what your gross income is before anything at all is taken out. For those folks who wait and be like, oh, I can't afford it, you get penalized if you don't sign up for Part B when you're first eligible, and if you don't have other insurance, like say through an employer. It's 10% for every 12-month period, and you can only sign up during special times to get it. It's typically at the beginning of the year. So, for example, in my next slide, Mary delayed 2 whole years. The premium's $185. Well, 20% for 2 years is $37. So now Mary's having to pay $222 because she delayed it. If you can get on one of those programs through the state that pay it, the penalty goes away. Okay? So that's some examples there. So in a nutshell, and I know I'm going kind of fast, but I know we're limited on time. Part A is hospital, Part B is medical. Part A, you have a deductible of $1,676 if you go in the hospital. Your first 20 days of skilled nursing are free. If you're in there longer than 20 days, it's $209.50 a day. Part B is going to be all your medical. You have a deductible of $257, and then typically everything else is 20%. And then you have that monthly premium to be in it, which is $185 that's taken out of your check. Is there any questions on traditional Medicare? Because that's traditional Medicare in a nutshell.
I have a question.
Yes.
My mother has Medicare, but how do I know if she has all the parts? I mean,
Okay.
I have her card, for instance, but.
Oh, so on the card, it'll say hospital Part A, hospital Part B, and have effective dates.
Okay.
So that way you'll know she's got A and B. And I'm fine telling it, I don't want to hold you up. If you have A and B, you typically also need D, which is a drug plan. Some people also will purchase a secondary insurance called a Medigap or a supplement. When you first turn 65, you get 6 months to where they can't deny you. They have to give you that policy. They can't do medical underwriting. It's called guaranteed issue. Though that plan pays everything but that $257. So it pays all your deductibles and co-pays on Part A, and it pays all your 20%. The only thing you would pay is $257. Typically, those plans start about anywhere between $100 to $120. I can tell you on those plans, I don't care what company you buy it from, you're getting the same benefit, but the companies can charge you more, and the prices will go up. If you wait, and it's sad, we've had people do this before, they've got a cancer diagnosis and they call us. You're not gonna get a supplement. Once you pass that 6 months, you're an open book. They're gonna look at your medical conditions. If you're diabetic, heart problems, more than likely they're gonna turn you down. And you're not gonna be able to get that supplement. I tell people if you can afford them, you need to get it right when you get 65. Now, if you're healthy, absolutely try and go for it. Just make sure, and again, if you were to call us, we would explain in more detail, you know, what to look for, what questions to ask them, so you're not just going and getting a plan. 'Cause I had one person, lady said, well, I took AARP, I'm paying more, but I'm getting more benefits. And I said, no, you're not. You're getting the same as somebody who would have Cigna, for example. And 1 year Blue Cross was real expensive. But the person didn't know that they're gonna get the same benefit no matter who they go with. It just depends on the company. And there's 3 ways they price them when you buy it, determines how much you're gonna pay. So again, that's why we're there, so you call us and we can explain that to you.
So if it's already past that time, she can't get something.
If she's got medical conditions, it could be really hard. And if they did take her, who knows what they're gonna charge her. Now, if you're disabled, you do not wanna purchase a supplement because it is so expensive. The only thing it does is pay the 20%. I had one lady paying like $800 a month just to get 20% paid. But as soon as she turns 65, she'd be able to get something else that would pay everything except that $257. In all honesty, it's gonna be based on their medical, is what I would tell you.
Screwed now.
It depends on what kind of medical she's got. But most people, because they start developing all those problems, it's hard for them to get it, because they do the medical underwriting. So does she have a drug plan?
No.
She didn't get a drug plan? How's she getting? We can talk afterwards.
She worked for Clay County Memorial in Washington.
Okay. Because I'm not going into Part D in here, it was just Medicare versus Medicare Advantage. But if you want to talk later, we can. But does that kind of make sense how traditional Medicare works? You got your A hospital, your B, your medical, you got those set costs. Is any part of that confusing? In all honesty, be honest with me, I know I'm going fast. Is everybody understanding it? Okay. Y'all want to talk Medicare Advantage? Okay. Okay, so a slight background, I was talking to this lady right here, and I know it sounds a long time ago, but in 2006, when the drug plans came out, that's when we got Advantage plans in our area. Bigger cities have had them forever. Bigger cities have like over 20 plans to choose from. We've always had like 2. It's always been Humana and United Healthcare. In the beginning, a lot of providers didn't take it because they were unfamiliar with how it worked. But we're still pretty much with the same 2. So, think of it this way, and this is how I like to explain it. I like to think of Medicare Advantage like an employer coverage. All your healthcare is wrapped into that company. They are private companies. They are approved by Medicare. Your drug coverage is included with it, and then your Medicare is in it. As everybody, I mean, most people had employer coverage where you just show them your card, and you've got set co-pays and deductibles, and everything's wrapped into one. The main thing to know, you are still in the Medicare program. And I'm just gonna use examples. Let's say you joined United Healthcare. You are still in the Medicare program, but no claims are going to go to Medicare. Everything's going to this private company to be paid. You're still paying the Part B premium because an Advantage plan, it basically encompasses all of Medicare. You still gotta pay the $185. And the Advantage plans may also have a premium of their own. But some people say, well, I'm not in Medicare anymore. Yes, you're still in Medicare, but you don't show them that Medicare card anymore. You're gonna show them your United Healthcare card, you're gonna show them your Humana card.
Well, the only problem about that, if they call Medicare, they will tell them they are not in the Medicare program.
I know, and that's
So,
the problem, is the
that's where you
language a
get
lot of
that.
times that people, and then they get all scared. They're like, well, why do I have to pay my Part B premium? I'm not in it. You are,
Right.
because it's all wrapped into that private company that's approved by Medicare, but you still have to pay it. Okay, so again, like I was saying, you're still in Medicare, you still got the protections, You still get all the cover services. They have to basically cover what Medicare covers. They may choose most of them for the majority will include the drug coverage. There's very few that don't do drug coverage. They may include extra benefits like vision, dental. I can tell you now on your dental, you're probably looking at cleanings. Okay, but it's not going to be major dental work. Your vision, they may pay for glasses. They may help pay towards an eye exam. The gym membership, that's my favorite. A lot of people go, well, I want the gym membership. I said, well, go buy one and then, I'll weigh it. And I'll explain why here in a second. On an Advantage plan, they try and get you in by the benefits. Most people don't think, do my doctors take it? Will my hospital take it? Will my skilled nursing care take it? Anything that would ever need to file a claim, do they accept your plan? Don't worry about these extra benefits. I can tell you right now, United Regional does not take you out. I talked to a lady the other day and we got to talk and she called me about transportation. And I was trying to make sure she didn't have a transportation benefit. And she told me she was in that and I was like, are you aware the hospital doesn't take it? She's like, what? And I was like, yeah, they're not in network with them. She had no clue. And she's like, well, what am I supposed to do? It's a small town, there's nowhere else nearby. I'm like, well, you might want to consider your options. I don't advocate either way for either one, but knowing that a really big hospital, they don't take it, they're not in network, it's kind of scary. But again, you see Joe Namath on the commercials, you get all the calls and see all the things on TV. They really pump those extra benefits. Forget the extra benefits. If providers think about your medical care, anyone who would file a claim, that's what's most important. Okay. There's different types, HMOs, PPOs, private fee-for-service, special needs plans. Special needs plans are basically going to be tailored to people who are Medicare and Medicaid, or people who might be a diabetic or have heart conditions. They do provide them a little bit of extra benefit because they're trying to keep them healthy. Maybe like talking to a nurse or giving them $30 a month to spend on supplies at the pharmacy, things like that. A lot of these plans used to provide transportation, they don't really anymore. HMOs, be very careful because with an HMO, you have to get prior approval. Like if you want to go see a specialist, they got to submit it for prior approval. PPO, you can pretty much, go to someone in your network. So if you're looking at these type of plans, my recommendation would be look at a PPO if you're considering going this route. Unless you do have special needs, that could be something to look at too. So again, you still pay your Part B premium. Some of these plans now will say, hey, we'll help pay towards your Part B premium. Like the lady I talked to who didn't know United Regional would take it, they pay $85 per monthly Part B premium a month. So she was like, ooh, why don't I have to pay the whole $185? They're paying $80-some of it. Some of them will help pay towards the Part B premium, not all. The plans could have premiums as well. So again, you're still paying your $185, or they might help supplement it. The plan has a premium. It could be nothing. It could be a free plan. It could be $97 a month. It could be $56 a month. It just depends on the plan. Typically, most of them will have a monthly premium in addition. They have their own deductible. So for example, and let me make sure it's not on the next slide, so I'm going to be repeating myself. Okay, so this is my example I use. We all know with Medicare, you go in the hospital, you're paying $16.76, right? That's your deductible. These plans might say, hey, for days 1 through 6, it's $300 a day. Okay, so let's do the math. You're in there 6 days. 300 times 6 is $1,800, right? You just now paid more than what you would with Medicare. But if you're only in the hospital 2 days, 600 doesn't sound so bad versus 1676. So you have to look at how much are they going to charge me per day when I'm in the hospital, and just kind of outweigh those costs. It could be cheaper or it could be more. Copay. They might have copays when you go to the doctor. Hey, your doctor visit's $25, your specialist is $45. Medicare's going to charge you 20%. You don't know what your 20% is going to be, but with these plans, you'll know what your copay is going to be. Some may also do a co-insurance, just like Medicare. They might say 15% or 20% in that nature. So I can't really go into detail on the particular plans because every plan is different. We'd actually have to pull it up and it would tell us exactly what all the services would cost. So that's why I said this part of it will be a little bit shorter because we can't, every plan is so different. They're structured differently. Okay, you have to live in the plan service area. So Medicare is nationwide, right? You go on vacation, something happens to you, you go to the hospital. Okay. You're in the Medicare Advantage plan, you go on vacation, something happens to you, your plan's not in their service area. You have to get in the service area. The plans we have here might not work in Dallas. And I know a lot of people go to some of these bigger cities for their care. So you have to be very careful on that. You have to have A and B to be in an Advantage plan. You have to follow the plan's rules, and you can only be in one plan at a time. So that is something else to consider. Do you travel? Or where are your doctors located? Are they in the cities, or are they here in this area? So you really need to think about something like that. Okay, so on the Advantage plans, if you're considering it, you can do it when your Medicare comes out. You have 3 months before, the month of, and 3 months after. During this open enrollment, which is Part D typically, it's October 17th through December 7th. Some people might want to say, hey, I want to join an Advantage plan. So we'll find them one, we'll sign them up, boom, it gets them on it. Or they're in an Advantage plan and they're like, no, I want to go back to Medicare. All right, well, let's get you a drug plan. We'll sign you up for the drug plan. Come January, you're back to Medicare. You're great. Now's the time people can make switches. If you move from your plan service area, of course you can make that change. If that plan leaves the Medicare program, you can make the change. If you're losing your employer coverage or something in that nature, and you want to go ahead and, because think about it, if you lose your employer coverage, you're now going to need a drug plan, or you can look at an Advantage plan. Let's see. Oh, this one, I understand it, but I kind of don't. If you move into or out of a nursing home or skilled nursing facility, I've run into a lot in the smaller areas where the skilled nursing facilities don't take that person's Advantage plan. So they have the opportunity, because they're in there for skilled nursing, to where they can get out of it and either go to one that the company accepts, or they go back to Medicare. So into or out of nursing homes, skilled nursing facilities. If the state pays your Medicare premium, or if you qualify for help to reduce the cost of your prescriptions, you can change whenever you want. And if it's your first time joining this Advantage plan, and you have a 12-month trial period, so if you joined it, and it's the very first time you joined it, and you're like, yeah, no, I don't want this, you can get out of it. It's so funny that they have a lot of ways to, also, from January through March, they have what's called a Medicare Advantage open enrollment, something in that nature. You can leave your Medicare Advantage plan and go back to original Medicare. If you do decide you want to do that, you just need to get a Medicare drug plan. You can switch from one Medicare plan to another. So at the beginning of the year, they do give people the opportunity to either get a different one or go back to Medicare. Because sometimes people are like, oh yeah, I found out my doctor's not taking this, it's not going to work, or they get in it and they're like, oh my gosh, what did I do? They want to get out of it. You cannot use this time to actually join an Advantage plan if you're in traditional Medicare. This basically either gets you out or gets you in another one. Okay, so I'm going to kind of expand off on some of this here. I'm not saying that they're both bad, Humana and United Healthcare at all. My thinking is, I know a lot of people have United Healthcare, and for some people, you know what, it works great. And I tell them, hey, if that's working for you and your doctors take it, you like the structure, absolutely. You don't need to make any changes. But for some people, they just don't work. My caution to you is, if United Regionals is not taking Humana, I don't know if that's something you want to consider joining. Okay, so again, that's kind of why we're here, to help talk you through all of this and explain the differences. And one thing I did find, and it's in your bag, it's called At a Glance, Original Medicare versus Medicare Advantage. This is basically your cheat sheet. So in Original Medicare, any hospital or doctor in the US that takes it, on an Advantage plan, you may have to use someone in that plan's network. The costs. So for Part B, you pay 20%. In an Advantage plan, your cost could vary. It might be 20%, it might be copay. The monthly premium for Part B, you're gonna pay it in both, but some of the Advantage plans may help you pay for it. And then the Advantage plan may also have their own premium to it. Oh, that's another thing that some people like. With Medicare, this is not the good part. There is no yearly out-of-pocket spending limit on your medical care. You're gonna keep paying and paying and paying. On an Advantage plan, they might say, oh, well, we have a $6,700 out-of-pocket limit. Once you've spent that, you're good. You know, you're not gonna be charged anything else. So Medicare you don't, and an Advantage plan you do. On Medicare, you can choose to buy the Medigap policy, and that's one thing real quick I'll touch upon. Let's say, well, I'm gonna use your mom as an example. Let's say your mom has Medicare and she bought a supplement, and now she wants to go to an Advantage plan. If she canceled her supplement, and let's say 2 years down the road, she decided, I don't want this Advantage plan, I wanna go back to Medicare. She's not guaranteed to get that supplement back. She's now an open book. They're gonna do the medical underwriting. Let's say mom has it, joined an Advantage plan, but she continued to pay the supplement's premium. As long as she pays that premium, it's not gonna be any good, but if she dropped that Advantage plan, she now still has her supplement. So that's another thing people do. They drop their supplement to get an Advantage plan. They decide it doesn't work for them. Now they want their supplement back, but they got all these medical conditions. Sorry. So you can keep it and pay on it if you join an Advantage plan, but I can tell you now, nothing gets filed to Medicare, so remember that. Medicare covers medically necessary services, your doctors, your hospitals, you know, things like that. An Advantage plan may cover your little bit extra. It may give you some cleaning on your teeth, but you gotta find a dentist who takes it. It may give you hearing aids, but it's only gonna be so much. You'll have a copay, and you might have to use somebody out of Lubbock or, you know, somewhere like through the mail. I don't know if anybody locally takes it. Medicare's not gonna give you a gym membership, an Advantage plan will. Typically on Medicare, you typically don't need prior approval. That service is done. On a lot of the Advantage plans you do, right? So that paper's gonna be in there. This one's a really good cheat sheet to kind of give you an idea of the difference between the two. Like I said, I'm not doing the benefits counseling anymore, but we do have Mindy and Jane. There are 2 benefits counselors. If you have any questions, in our pamphlets and all kinds of information's in there, our phone numbers everywhere, those are the 2 you would want to call. And we've always done this. For example, if I was the benefits counselor and I got the person, that person's stuck with me now. They're gonna call me for everything they need. We're not gonna pass them on to somebody else. If you call and you get one of these caseworkers, that's who your worker's gonna be. They're gonna be with you. That's like when I was telling you, you become friends with people. Because I've had people that call me every single year for like 10, 15 years. We spend more time talking about our kids and our family than we do compared to drug plans, because you get to know the person and we want to build that rapport with y'all. So either one of them's fine. They're both really good. But that's who you want to contact if you have questions on the benefits counseling. Is there any questions? So believe it or not, I actually have a 2-hour presentation on this stuff, which really goes into detail. That's how complicated it is.
Let me update some things that are happening with traditional Medicare. Before, you didn't have to get anything pre-approved. Started in January of 26, there are some things you're going to have to get approved. And one of them is there's certain drugs. So if you're taking Eliquis and something like that, you're going to have to get that pre-approved before your drug plan will kick in. Also, there are some surgical procedures. Most of them are orthopedic in nature or neurosurgery. Most of them brain stimulators or any kind of pain stimulators. you're gonna have to get that pre-approved, before the services, can be performed. Um, These are new, and this is basically kind of a trial run that Medicare is doing. On the drugs, you got to get approved. That basically has more to do with the program that's called the 340B program, which basically saves you guys money. When you go to the pharmacy to get your drugs, you get it basically at a discount. So those are kind of the two updates. Now, I will say this, on a Medicare Advantage plan, any X-ray that you have other than just a standard X-ray is going to have to be pre-approved. So if you're going to need a CT scan, an MRI, a PET scan, or anything else, you're going to have to get it pre-approved.
Sounds like they're reverting to Medicaid.
Do what?
It sounds like they're reverting to Medicaid.
Well, in Medicaid, yeah, well, Medicaid, really, there are a few things that you've got to get pre-approved, but Medicaid is getting pretty strict. But on Medicare Advantage, most everything, if you want to go into, you have to go into a rehab facility, a long-term care, a long-term acute care facility, you got to get that pre-approved. And the problem with Medicare Advantage is, if you have to go into what we like say skilled nursing, our skilled nursing is called swing bed program. If you go into that, most Medicare Advantage programs are only going to approve you for 2 or 3 days. So what happens is you have to continue to get approval if they need to stay any longer. And I can tell you, if anybody's had to go into a rehab facility, you're going to probably be there more than 3 days. I don't think whether you come to us, Encompass, or anywhere else, you're going to stay more than 3 days. So that can be a pain in the neck. Also, Medicare Advantage plans do not pay hospitals very well. That's one of the reasons why United Regional only accepts 3 Medicare Advantage plans. United Healthcare, Aetna, and American Home Plan, Health Plan. American, they're the only 3 that they accept. So if you go to United Regional with one they don't accept, you're out of network. So they're going to pay out of network.
Like 50%.
Yeah, you're
I was
gonna,
looking at it the
you
other
may have
day.
to, you may have to pay a lot more money out of pocket than what your Medicare Advantage plan says you have to pay. The other part of that is, April mentioned the Medicare Advantage plans have a out-of-pocket limit. Most of them now is around $8,000 a year. I will tell you this, when you look at the cost of your Part B Medicare on traditional Medicare, and what a supplemental insurance or a gap Medicare, what they call it, Medigap insurance. If you total all that out, you're still going to be less than $8,000 a year on most supplemental plans, Medicare, traditional Medicare supplemental plans. You're going to be less. So I want you to look at that, because when you get a Medigap plan, the only thing you pay is the deductible. I think the deductible goes up in 26 to 280. Do you remember? It's gone up. It may be 260 something or I can't remember. I'm sorry. I should know that. And the Part A is going to go up to like 17 something. Anyway, they pay that. So the only thing you're going to be out of pocket is your deductible, which is going to go up to, I think the deductible for Medicare, traditional Medicare, is going to 280 in 26. So there's and also, as I mentioned in the beginning, on your Medicare Advantage, to explain how Medicare Advantage gets paid. Medicare pays the Medicare Advantage plans for those beneficiaries on those plans. They pay what they think is about 95% of what they would have to pay out. they actually pay the Medicare Advantage plan. So, and then the Medicare Advantage plan can offer you additional services than traditional Medicare, but you usually are going to pay for that. There are more complaints with Medicare Advantage programs because they're not paying, or they don't pay the way they're supposed to pay, because Medicare Advantage plans are supposed to pay the exact same way that traditional Medicare pays. They don't do that. As the CEO of the hospital, I can tell you, my CFO sitting right there, they don't pay us the same way that Medicare pays us, or we pay some hospital like United Regional. So again, I mentioned there's some they tweaked some of their plans. A couple of weeks ago I was looking through because I'm on Medicare, and so I wanted to see if okay, is there a plan out there that I would like, and there wasn't. But what I did notice that in some of these plans, it will tell you that Part B may not be included. So you have to, and I think some of that is if you're in a nursing home. So there, read the fine lines, because I read and I've got it in here. I can pull it out if everyone will see it. But, I can tell you too, the plans that have zero premium, there are still a few that have it. Those days are gone. They're going to start charging deductible. I mean, a premium for your Medicare Advantage plans. So they have changed for 26. So be sure, and I do, please, you can call us at the hospital. We'll be glad to help you. Call April and her bunch out there at on the area agent. What is it?
We call ourselves the AAA.
AAA.
Just to make it easy.
Because the salesperson that's selling you that Medicare Advantage plan, he doesn't know it. He or she does not understand. They're going by the talking points that the company has given them to
And those 800
sell.
numbers, remember my transportation lady? The person she talked to had no idea that our local hospital would take it. I mean, she didn't tell her that.
Right.
Don't call these 800 numbers.
No, I think she's absolutely right.
Talk to someone, if you're interested. I prefer us, because we have no vested interest, because it's my understanding the agents, once they get you signed up, they get so much each year that you're in it. But I do want to clarify one thing. We have a lot of retired state employees, and sometimes they actually have a special advantage plan for the state employees. Those are fine, those work great. But if you have one of those and you do go for medical care, make sure you specify it's through the state and not just a normal one, because I haven't found problems with those. I don't get a lot of calls from people on them, but those seem to be okay.
Unless you're a teacher, and I can tell you, because we get a lot of teachers that come to us complaining because of their retired teachers. Also, with the Medicare Advantage, and I'm gonna give you one example, and then I'll be quiet. But it's my mother-in-law. I'm gonna use my mother-in-law as an example. Earlier this year, she was in the hospital, and she was really sick, and she needed physical therapy. So we had planned to bring her here to Henrietta and put her on our swing bed program. And she lives up by Amarillo. She lives in the Panhandle. And so we were fixing to go up there and get her. My wife was already up there. I was fixing to go up, and we were going to get her and bring her here. But her Medicare Advantage plan, it's whoever the teachers are with, and I don't know who that is right now, but they did not allow her to go to the swing bed program. Here's why. Here's why the reason they denied it. They said she could walk 200 feet without assistance. What was not in that physical therapist notes was that there was somebody right behind her with a wheelchair, and she was up against the wall. So when she walked, if she needed steady, she could do that, or if she was tired, they could. So and we should have probably appealed that, but we didn't. We still brought her back here. We did get her some physical therapy out there at the hospital, which helped her quite a bit. So if you have Medicare Advantage and you want something and they deny it, appeal it. And if they deny it again, appeal it again, because that third time, I think it's something like 87% get, 87% that appeal it 3 times get it, or twice, I guess, get it approved. So don't give up. We'll be glad, come out to the hospital, we'll be glad to help you do that. So we will fight for you. So don't, and if for some reason you're at United Regional, they'll do the same. I tell people I'm so happy that United Regional has joined our fight with us this year. And we're going to probably be looking into of only accepting a few plans, just like United Regional. I think that's going to be.
I think just here we have you. I know Bowie has a different one, but I know like typically our area is just United and Humana.
Is that it?
That's it.
So, but anyway, if you need any help, call.
Now, not me, because I'm not doing.
Just call the area agency, the area agency on aging.
We got Jane and Mindy.
Come out and talk to me, talk to Deborah. We'll be glad to go over with you. We did, we sat down with several people last year that came out and had questions. Come out and talk to us. Does anybody else have any questions on maybe what we do at the hospital, what we, how we handle some things?
It's a quiet bunch, isn't it?
Okay. Well, again, I want to thank you for coming. I thank Judge Campbell for allowing us to use the county facility here to put this on, and we'll stick around for a little while. If anybody's you got it.
Okay, y'all are gonna talk about the other plans like Plan F and Plan G.
Okay, so those are supplements.
Okay, oh, those are supplements.
Those are supplements, because they just asked for
We're just talking
Medicare.
about Advantage.
Yeah, they just asked for Medicare Advantage, but I am gonna do this little pipe for Part D. I can tell you now on the drug plans, we went from 20-some plans down to 12. And I'm sorry, I get passionate about some of this because I hate it when people are being taken advantage of. These plans are strictly based on what you take, what pharmacy you go to. I'm not saying do not. If you call an insurance agent, they are only licensed to put you in certain plans. We look at all plans. When there used to be 20-some plans out there, we compared all 20 plans. We know how to use the plan finder because it has little quirks. That's what the girls are doing right now. It's all based on you as an individual, what you take, where you go, your strength, your quantity. We talk about prior authorizations, quantity limits. We look at all of that for you. It will tell us right away how much it costs. And I might say, hey, I hate to ask you this, but would you be willing to change pharmacy? I actually have an intern that I'm working with at MSU, and we looked at his Advantage plan because he gets it, but then I also did my in-laws drug plan. Those premiums are getting horrible on Part D. I did not realize how bad it is. So if you have a drug plan and you don't compare it, please compare it. Do not let yourself be spending too much money.
And I will tell you this too, if you're on traditional Medicare and you do not have a drug plan,
Oh,
Yeah.
do not buy a drug plan in the middle of the year because they're going to charge you for the whole year. If you can, wait until January, or wait until.
well, you have
the
to do
January.
it during open enrollment,
Right.
but the problem is you get penalized 1% for every month you could have been in a drug plan and you chose not to. So if you got on Medicare back in 2020 and you're like, I don't want a drug plan. It's going back to 2020.
And you get.
And it's
penalized for the rest of your
1%
life.
for every month
Yeah.
you chose not to be in one, and they multiply that by the national average. Whatever that number is added onto your premium for whatever plan you're in.
So do it
They're
during open
optional,
enrollment.
but unless you get extra help, then the penalty goes away and you have more
And then it clears
flexibility.
it. Well, my insurance guy did not carry the Part D plan that he thought I should be on. And he told me to go home and sign up for it myself.
Wish you Some insurance agents are honest, because they'll be like, you know what?
He's very
I don't have a good one
And that's
for you,
why I go to
call us, because
Yeah.
there's one in Wichita that does
But
it.
he said,
Yeah.
just, this is the one you should be on, and I have a cousin who does this all the time for everybody in the family, and she said he was right, and it's WellCare.
Maybe. They
And
change
I
it
got
every
on
year.
it, and so far, so good.
Okay, but have you looked at it, because they will change what medicines they
I'll have
cover,
to
what
look.
pharmacies
I'll have
they
to look.
use, the cost. WellCare is a better one right now from what I've seen.
Well, he just said, I don't carry this, but this would be better
Yeah.
for you, because
Check
it's
it out.
$5 a month. I mean, it's cheap.
But check.
I
check it
can tell
out.
you that Henrietta Pharmacy is on most of those drug plans.
Okay,
So-
but I mean, he was just so nice, he goes, you know, I don't have what you need, but this is what,
I
go
love
home
him
and
for
look
that.
this up. And I was like, okay.
That's an awesome, we had an agent that strictly dealt with AARP plans. These people were paying astronomical amounts, and I finally talked to her, so now she's like, just because it fits within the plans you have doesn't mean it to be in it. She'll be like, you know what, call them.
Right.
Let them look at it for you, because it's such individual based. Do not listen to friends and family and what they have, because everyone's different.
Well, my cousin is really good at, anyway, she does it, she should be an insurance person.
If you guys